The seemingly harmless buffet selection you've just picked up might land you directly in the ship's infirmary with medical expenses exceeding $1,000 for something entirely avoidable. I'm going to reveal 10 items that medical professionals are pleading with older adults to stay away from aboard cruise vessels. Several are clear contamination hazards. Meanwhile, other items pose hidden dangers by reacting negatively with prescription drugs in ways the shipping company won't disclose. Item number 7 has resulted in more senior hospitalizations than anything else mentioned here, yet it appears at every buffet station daily. What truly surprised me is that 2025 has set a new record as the most problematic year for cruise ship disease outbreaks. We've already seen 20 digestive illness episodes, and the count continues rising. This represents the greatest number documented since record-keeping began in 1994. When you've passed age 65, your body's defense mechanisms have declined from their former strength. Something that might cause a person in their 30s only minor digestive upset could result in your hospitalization with serious fluid loss requiring intravenous treatment, and the cruise companies are counting on your ignorance of these facts. Let's begin with the first item. Uncooked oysters and other shellfish represent the primary source of foodborne disease aboard cruise vessels. For older passengers, the outcomes can be catastrophic. The information cruise companies withhold is this: uncooked shellfish contains Vibrio microorganisms that flourish in heated ocean environments. According to CDC data, individuals above 60 face risks 10 times greater for developing fatal complications from Vibrio contamination. The part that infuriated me most is this: despite cruise companies adhering to rigorous safety measures, uncooked shellfish remains displayed at buffet stations for extended periods. Temperature variations occur. Cross-contamination becomes unavoidable when countless travelers help themselves using shared serving tools. A ship's physician confided to me privately, during a single week, we admit more elderly patients due to raw oyster consumption than from any other individual food throughout the entire month. The cruise company is aware of this situation. They simply prefer not to frighten potential customers away. Your body's defensive capabilities no longer match their previous effectiveness. What produces minor discomfort in someone aged 30 sends someone aged 65 to the medical facility with severe fluid depletion requiring intervention? The answer: choose thoroughly cooked ocean fare. Flame-grilled prawns, oven-prepared fish, lobster portions, all tasty and far safer. Request items from the formal dining area where preparation occurs freshly, avoiding the buffet completely. Yet uncooked shellfish merely scratches the surface. Second on the list: buffet scrambled eggs. This revelation will astound you. Those puffy golden eggs resting in heated serving trays aren't genuine eggs. The majority of cruise vessels utilize powdered egg substitutes stored in commercial containers. The danger this presents to seniors is significant. To begin with, the salt concentration is extremely elevated. For those managing hypertension or cardiac conditions, you're receiving an enormous sodium dose unknowingly. Additionally, these artificial eggs remain beneath warming lights for hours within the bacterial risk range spanning 40 to 140 degrees Fahrenheit. A ship's dietary specialist disclosed to me that by 9:30 in the morning, those eggs have sat exposed for more than 60 minutes. Bacterial populations are increasing, and elderly passengers with weakened defenses face the greatest vulnerability. The medication conflict they fail to mention is this: individuals taking anticoagulants such as warfarin may experience interference from the vitamin K present in these egg items. Most elderly passengers remain unaware until their INR measurements surge during their voyage. The answer: visit the omelet preparation area where authentic eggs are freshly cracked and prepared on demand. Even better, request eggs in the formal dining space. Helpful advice: should you choose buffet eggs, only select them during the initial half hour of availability. Beyond that time frame, avoid them completely. The following item concerns cheese, and the medical data is frightening. Third item: unpasteurized soft cheeses. That elegant cheese display appears wonderful. However, if you've surpassed 60 years, certain cheese varieties pose serious health gambles. Soft cheeses that haven't undergone pasteurization, brie, feta, may harbor Listeria microorganisms. For older adults, Listeria contamination carries a 10-fold increased likelihood of causing severe complications compared to younger individuals. The cruise ship element is this: cheese remains at ambient temperature throughout wine sampling and social gatherings. Even pasteurized varieties become hazardous after extended room temperature exposure. CDC reports indicate adults beyond 65 represent nearly 60% of listeria-related hospital admissions. Manifestations include elevated temperature, muscular discomfort, mental confusion, and in extreme instances, meningitis. The answer: choose firm cheese options like cheddar, Swiss, or Parmesan. At wine samplings, inquire, have these cheeses been pasteurized? What's their exposure duration? If confident answers aren't forthcoming, decline. Yet cheese pales compared to what follows next. Fourth item: rare or inadequately cooked meat. That ideally pink steak may appear appetizing, but for seniors, undercooked meat represents a pending medical crisis. The biological facts are these: with advancing age, gastric acid secretion diminishes by as much as 40%. Gastric acid serves as your primary barrier against foodborne microorganisms. Reduced acid levels mean microbes such as E. coli, Salmonella, and Campylobacter encounter far less resistance in causing illness. The cruise ship hazard amplifies this risk. Food preparation areas are simultaneously producing thousands of dishes. Temperature management isn't consistently optimal. What should be medium rare might actually contain dangerously raw sections centrally. A ship's medical officer recounted this incident. We treated a 68-year-old traveler who requested a rare steak at the specialty steakhouse. Less than 12 hours later, he arrived at our clinic suffering severe E. coli contamination. He remained bedridden for 3 days and missed every destination. The pharmaceutical consideration: individuals taking proton pump inhibiting drugs like omeprazole or Nexium for gastric reflux face heightened vulnerability. These pharmaceuticals decrease stomach acid, facilitating bacterial survival. The answer: consistently request meat prepared well done or medium well. At buffets, reject any meat displaying even minimal pink coloration. If you're finding value in this content, press that approval button immediately. This assists other seniors in locating these vital tips, and subscribe to ensure you don't miss essential cruise safety guidance. The next hazard lurks in your morning beverage. Fifth item: unpasteurized milk and cream. The cream you're adding to your coffee might pose a health threat. Certain cruise vessels, particularly those traveling European waters, utilize dairy products that haven't been pasteurized. These may contain Listeria, Salmonella, and E. coli. The more significant issue is this: even pasteurized cream becomes dangerous when left at buffets for extended periods. Microbes reproduce quickly at ambient temperature. By mid-morning hours, that cream container has become a microbial incubation site. Your declining immune defenses cannot combat these microorganisms as they once did. What triggers mild upset in younger individuals can result in severe sickness and hospital care for older adults. The answer: utilize individual sealed cream portions whenever available. In the formal dining area, ask your attendant, has this cream been pasteurized and recently opened? Helpful advice: pack your own powdered cream packets from home. They remain stable at room temperature and pose no risk. Yet dairy isn't the sole breakfast hazard. Sixth item: freshly cut fruit from buffet stations. Fresh fruit appears to be the most wholesome option, yet for seniors, it ranks among the most hazardous. The issue is this: freshly sliced fruit sits exposed at ambient temperature for hours. The instant fruit undergoes cutting, it becomes susceptible to bacterial invasion. Cantaloupe and honey-dew melons present particular danger. Their textured exterior surfaces shelter bacteria that migrate to the inner flesh upon cutting. The CDC has connected numerous cruise ship disease events to tainted melons. For seniors managing diabetes, this presents a dual hazard. Elevated glucose levels weaken immune responses, intensifying infection severity. The cruise ship element worsens this situation. Countless travelers handle serving implements, sneeze in proximity to produce, and create cross-contamination with unwashed hands. By 10 a.m., that fruit container has become a bacterial paradise. A ship's nutrition expert informed me, we observe more digestive complications from buffet fruit than nearly any other offering. Seniors suffer most severely because their immune capabilities cannot effectively counter the bacteria. The answer: request fresh fruit from the formal dining space where cutting occurs to order. Select whole fruits suitable for self-peeling. Bananas, citrus fruits, apples. Helpful advice: if buffet fruit consumption is necessary, only take portions during the initial 30 minutes of service availability. Item number 7 has hospitalized more elderly passengers than anything else listed here. Seventh item, mayonnaise containing salads. Potato salad, coleslaw, chicken salad, tuna salad. These represent the primary foodborne illness source aboard cruise ships for older adults. Their extreme danger stems from this. Mayonnaise generates ideal conditions for bacterial proliferation. When these salad preparations sit exposed at buffets, even briefly for half an hour, bacteria multiply dramatically within the hazard range of 40 to 140 degrees Fahrenheit. The senior-specific hazard: you face increased likelihood of developing severe fluid depletion from food contamination. What begins as minor stomach discomfort can rapidly progress to dangerous dehydration necessitating intravenous fluid replacement. A ship's physician shared this account. We treated a 72-year-old female passenger who consumed potato salad during midday buffet service. By evening mealtime, she arrived at our clinic experiencing severe nausea and dehydration. She spent 2 days receiving 4 fluids and missed 3 destination ports. Her medical charges exceeded $2,000. The medication conflict. Individuals taking diuretic medications for hypertension or cardiac insufficiency experience life-threatening dehydration much more rapidly. The answer: eliminate all mayonnaise-containing salads from buffet consumption. Without exception. For those desiring these preparations, request them from the formal dining area where fresh preparation occurs. Yet mayonnaise salads aren't the sole concealed danger. Eighth item, sushi and uncooked fish. Sushi stations appear impressive, yet for seniors, they constitute a minefield of health dangers. Uncooked fish may harbor parasites, microorganisms, and pathogens that your declining immune defenses struggle to resist. Anisaki's parasites can trigger intense abdominal distress, nausea, and vomiting episodes. The cruise vessel hazard. Despite rigorous safety measures, sushi remains displayed at buffet areas. Temperature regulation is essential, and even minor variations generate hazardous circumstances. For those taking immune-suppressing pharmaceuticals, managing diabetes, or facing any persistent medical condition, your danger level escalates dramatically. The CDC specifically cautions adults beyond 65 to reject raw fish aboard cruises. The answer: choose cooked sushi varieties, tempura shrimp, cooked crab, vegetable combinations. Should you absolutely require raw fish, exclusively order from specialty dining establishments where fresh preparation occurs on demand. Helpful advice: avoid sushi completely at port destinations. The ninth item is something consumed daily. Ninth item, unpasteurized juices. That freshly extracted orange juice appears healthful, yet it might conceal dangerous microorganisms. Juices that haven't undergone pasteurization may harbor E. coli, salmonella, and additional harmful bacteria. Your reduced stomach acid cannot eliminate these microbes as previously. The medication conflict presenting particular danger is this: grapefruit juice reacts adversely with numerous common pharmaceuticals, statins, hypertension medications, anti-anxiety treatments. A ship's pharmaceutical specialist told me, we had a 70-year-old traveler whose hypertension medication ceased functioning because he consumed fresh grapefruit juice each morning. He nearly lost consciousness before we identified the cause. The answer: select pasteurized, individually sealed juice products. For those taking medications, completely eliminate grapefruit juice. Helpful advice: carry a medication list and consult the vessel's medical personnel regarding dietary conflicts. Finally, the 10th item appears innocent yet has generated serious complications. 10th item, self-dispensing ice cream. Self-service ice cream dispensers are microbial breeding environments. Soft-serve dispensing equipment proves difficult to sanitize adequately. Microorganisms like Listeria flourish in the cold, damp conditions inside these devices. For older adults, Listeria contamination presents particular danger, producing elevated temperature, muscular discomfort, mental confusion, and in extreme instances, meningitis. Self-dispensing equipment receives contact from countless travelers daily. Cross-contamination proves unavoidable. The answer: request ice cream from dining establishments where scooping occurs from sealed packages. Select pre-wrapped ice cream products. Essential safety guidelines. These are the fundamental principles for secure cruise dining after reaching 60. First principle: the formal dining space consistently offers greater safety than buffet service. Preparation occurs to order with immediate serving. Second principle: Reject anything remaining exposed beyond 30 minutes. Third principle: when uncertain, question your attendant regarding preparation and storage methods. Fourth principle: carry your medication list and verify dietary conflicts. Fifth principle: maintain hydration using bottled water. Keep in mind, your immune defenses no longer match their former capacity. What appears as excessive caution could genuinely preserve your life. Yet here's something most cruise travelers fail to recognize. Your approach to food safety actually influences how staff members regard you. Certain behaviors establish you as their preferred passenger, while alternative behaviors, well, they maintain secret terminology for problematic guests. I invested 3 months locating 12 former cruise staff members who ultimately consented to reveal honest opinions regarding senior travelers. Their disclosures will shock you. Certain revelations will bring smiles. Others might surprise you, yet all of it could revolutionize your treatment during every subsequent voyage. View that content next. The information might astonish you regarding what they